predicting the course of coronavirus here, has described the pattern of people contracting the virus, needing hospital treatment, intensive care, or dying from Covid-19 infection. The deaths of 9 more people have been reported in the last 24 hours here, bringing the total to 1,639 people. Over half of those losses have been from people living in nursing homes. The government will decide late next week if more restrictions on our lives will be lifted, including moving up to 20 kilometres away from people's homes to see more people. Philip Nolan is chair of the NPHET Irish Epidemiological Modelling Advisory Group. We can speak to him now. Professor Nolan, good morning.
Morning, Gavin.
A number of weeks ago, when the reproductive rate, the number of people getting the infection from those who already had it, had been reduced, you said the prevalence of the disease was still too high. What do you think now?
Yes, indeed. What really matters here is what we call the force of infection, and that is the rate at which new cases are emerging in the population. And that's a product of the number of people out there with infection and this reproduction number that we're all familiar with now, how quickly those individuals are spreading it to others. So to ensure that the level of disease in the population remains very low, both of those parameters have to be low. You have to have a very low number of infections in the community, and you have to keep the reproduction rate at or below 1. And if you keep it below 1, the number of infections will ultimately decline to almost 0. So at this point in time, I did use those words, astonishingly stable. You can imagine the period immediately after the 18th of May was a period of some anxiety for the National Public Health Emergency team, wanting and hoping that the people of Ireland would continue to be cautious and careful in how they went about their business and not spreading this disease. And over the last week to 10 days, all of the indicators suggest that there hasn't been a significant increase in the spread of the disease since the 18th of May. And that is a testament to the fact that the people of Ireland have learned how to begin to go about their business and not spread this virus.
Where is the disease now?
So the disease, if you look at any given set of cases in a day, about half the cases are emerging as contacts of known cases or isolated cases in the community or cases in households or cases in extended families. About a quarter are in healthcare workers. The incidence in healthcare workers is a tenth of what it was about a month ago, but they're still a high-risk group, and we need to do everything we can and have been doing everything we can to protect healthcare workers. And about a quarter are in the sort of outbreak settings, such as meat processing plants and still some outbreaks in long-term residential care. So the cases, the low numbers of cases are emerging in a mix of settings, and it is going to be very important to watch infection prevention and control in workplace settings as more and more workplaces come back.
Much of the figures that you have been dealing with largely capture what was happening at the end of the lockdown. How will that prevalence change as we spend more time with more people?
Well, there's always going to be a risk. I mean, the spread of the disease in the population depends upon the number of contacts and how you reduce the risk of any given contact leading to infection. So for a long time into the future, we are going to have to limit our social and physical contacts to what's necessary for our well-being and for restarting the economy. So we'll always be thinking about how do we limit the number of contacts, and we'll always be thinking about how do we reduce the risk of infection by hygiene measures, by maintaining some level of distance when we have to come into contact with other people, by using face coverings where appropriate, and really importantly, by self-isolating as soon as we have any symptoms suggestive of this disease. All of these things come back to issues of individual responsibility, to us all behaving as if there's a risk we have the virus and being really conscious of not spreading it to anybody else. If we maintain those measures, And if we use our testing and contact tracing, and by use I mean that if I develop symptoms, I immediately call my GP, get tested, and have my contacts traced. It is possible to, over time, in a cautious manner, rebuild many of our activities and not spark off further waves of infection. But I have to emphasize, any step forward we take does carry the risk and therefore requires constant monitoring of that risk of an unanticipated resurgence in the virus.
What about international experience? Other countries who are further ahead of us in terms of their easing of restriction. For example, on countries who've eased social distancing. Denmark reduced their social distancing guidelines from 2 metres to 1 metre on May the 11th, and at that time their daily case rate has fallen from 110 new cases on May the 11th to 27 new cases on May the 25th, 32 cases yesterday, and they have their schools open. How are you using international experience to predict what will happen here?
So, looking at it very carefully, as the Chief Medical Officer would have said in other contexts, we do constantly monitor what's going on in other countries. One of the things that surprises even the statisticians who understand this work very well is how long it takes for any given intervention, particularly the lifting of a restriction, to have an effect. It takes time for the disease to re-emerge in the population. So, first of all, we need to give it time. The second thing is we need to be very careful. So, even though we think of Western Europe as being relatively homogeneous, people behave, different countries have different cultures and different social structures. For instance, classrooms and school structures vary quite widely across Europe. So first of all, we need time, and secondly, we need to be careful of our interpretation of the results from other countries, because what happens in one context may emerge somewhat differently in another context. So very useful information, very useful evidence, very useful precedent. I just would urge two things: caution in terms of how quickly we jump to a conclusion, and then caution about how we consider the context in which, for instance, a Danish school or a Swedish school or a German school operates compared with how an Irish school operates. There are significant differences between those. But nonetheless, very valuable lessons to be learned, and therefore one of the kind of important aspects of this epidemic has been the level of collaboration across European nations, particularly through the European Centres for Disease Control, and how useful that information is collated and relayed back across the EU.
Philip Nolan, thank you very much for speaking to us, and hope to speak to you again soon. That's Philip Nolan, Chair of the National Public Health Emergency Team's Irish Epidemiological Modelling Advisory Group. 8:25 now.
There have been more bleak warnings this week about the economic havoc unleashed by COVID-19. Both the Fiscal Advisory Council and the Economic and Social Research Institute warned the country is facing into a significant recession. The pandemic has left well over 1 million people requiring state income support. Joining us now this morning is the Minister for Finance, Paschal Donohoe. Good morning.
Good morning, Rachel.
You'll have to make some big decisions soon. What will you be doing with the pandemic unemployment payment?
We'll be making a decision in relation to that across the coming weeks. The Taoiseach and I have already indicated our plan to continue the pandemic unemployment payment programme beyond the current expiry date. And we'll be making the final decision in relation to that, the duration and the nature of the payment in the coming week or so.
I suppose the fundamental question is this: for people who had been working full time before all of this happened, will the €350 payment remain as it is?
Well, we'll be in a position to absolutely confirm that in the coming days. What I would say to those listeners who have that concern is the very reason we increased that payment from approximately €200 to €350 was in recognition of the huge difficulty that so many were facing because of the loss of income and because of the loss of job. And that instinct and that view that guided the increase in the payment of course, will be the same instinct that will guide our view in relation to those who are in full-time work and full-time income before they lost their job.
So
The
you hope
reason,
then to
Rachel,
keep it
we're
at
simply taking...
350?
Well, Rachel will confirm that now when we have a cabinet meeting. What we'll have at the end of this week is we will have our second week of information, which will allow us to understand the number of citizens who are leaving the pandemic unemployment payment to go back into work. We're in the very early phase of reopening our economy, and we're looking just to take care with a decision that does two things. Firstly, recognise the need of those who are now depending on that payment for income. And secondly, just recognising that this is costing many hundreds of millions of euro per week. And any decision we make, we need to make sure is affordable and sustainable. And we're drawing that work to conclusion in the coming days.
At the moment, women returning from maternity leave are excluded from the wage subsidy scheme. Now, a lot of people have expressed concern about this. When is this loophole going to be closed?
I'll be taking a proposal to Cabinet today in relation to this, Rachel. We brought in the temporary wage subsidy scheme as a huge and fast intervention to keep many hundreds of thousands of citizens either in a job or to allow them to retain a relationship with their employer. It's been very successful in doing both. And after the introduction of this scheme, the issue regarding those on maternity leave and their inability to access the scheme was raised with me. And myself, the Department of Finance and the Revenue Commissioner have been working hard on this issue over the last number of weeks. I have a proposal. I will bring it to Cabinet today. And what I'm looking to do is try to ensure that somebody who's now leaving maternity leave to go on to the wage subsidy scheme, that we can treat them in the same way as somebody else who may already have been on the wage subsidy scheme. I accept the concerns that were raised. It's our absolute intention to treat everybody fairly, and I hope later on today we'll be able to bring clarity to that important issue.
Looking at the broader picture, the European Commission has proposed a €750 billion package of grants and loans to help countries recover from this crisis. When's that likely to be finalised, and what will Ireland be looking for?
So in terms of that broader picture, if I could briefly say, in acknowledging the huge difficulty that you picked up on correctly in the two reports that were published earlier on in the week, the reports were also clear that our economy can recover and we can make the right decisions to get our economy and our people to a better place economically. And we can do that because we didn't have the kind of economic difficulties leading into this crisis we've had in the past. In terms of the European Recovery Fund, when will it be finalised? My anticipation is it will be finalised towards the end of this year, and funding from it will become available either from the end of this year or early next year. In terms of what Ireland will want from it, there's two things we will want. Very directly, of course, we will be reviewing that fund to see if there's an opportunity for us to fund programmes that we currently have in Ireland or to fund new things better in the future. Indirectly, however, this fund and the work of the European Central Bank is the vital sign of confidence regarding the future of the euro. That confidence was lacking a decade ago. And as a country who's a member of the euro and a big trading small country in the eurozone, that kind of confidence is a vital enabler of the economic recovery we want to return Ireland to.
Again, looking at the overall sums here, both Fianna Fáil and the Greens made pre-election pledges not to increase the pension age to 67. Given everything that's happened since then, is that still realistic?
Well, Rachel, I'm engaging with my colleagues in the Green Party and Fianna Fáil on this on a whole range of matters.
Right, so you are discussing that?
I said in relation to a whole range of matters, and of course, the how we're going to manage pension issues, how we're going to manage the future of our income supports will all be part of the discussion that we will have. These are discussions that we're hoping to use to form a new government. And one of the agreements that we've made is we won't kind of make public our conclusions until that work has concluded. The context for all of these decisions has completely changed because of COVID, because of having hundreds of thousands of people now unemployed. But we will only be able to answer questions like that if we can agree a programme for government. And we're working really hard to try to do that at the moment.
There have been concerted calls this week for the reduction of the 2-metre distancing rule. Your own cabinet colleague Michael Ring thinks it should be reduced. What's your view?
I'm going to be very much guided by the public health guidance in this area, as indeed all my cabinet colleagues are. I just had to listen to Professor Philip Nolan, been interviewed before I came on, to be reminded of the kind of expertise and insight that Philip and his colleagues have on this and many other matters. We will look at the evidence in this, and I will be guided, excuse me, Rachel, by that evidence and by the success that we have in reopening our economy while hopefully containing this disease.
Right. Does that mean then that for as long as Tony Holohan says 2 metres, you're sticking with 2 metres?
Well, I'll take his advice and input in the matter very carefully, and then I'll seek to balance that against all of the other things that I'm directly responsible for as Minister for Finance.
What does that mean?
Philip, in the interview that he gave a few moments ago, for example, made the point that getting people back to work is not only vital for our economy. He talked about many of the different costs and issues that we have at the moment in our economy. I'm directly responsible for all of that. But what I want to do is that if we make further decisions to reopen our economy, that we do that in a way that does not undermine the success that we have had in containing this disease. And in order to look at that success, I will be relying on a weekly basis on the kind of information and advice that we get from Tony and his team. And if the evidence supports any kind of change in the public health guidance, and I believe we can accept that guidance and reopen our economy in a careful way so that we can get more people back to work, of course we look at those conclusions.
Paschal Donohoe, Minister for Finance, thank you for joining us this morning. It's 8:34. Let's get the news now from Carla O'Brien.
Thanks, Rachel. The Chief Medical Officer has said that the National Public Health Emergency Team is looking at the experience in other European countries when it comes to easing measures around schools and childcare. Dr. Tony Holohan said that for the most part, other countries have not seen a significant